I'd like to look over the program for the next couple of days and to discuss our shared goals. This is truly a multi-faith moment where diverse religious denominations and faith traditions and faith-based organizations are coming together around a common calling to protect life, to uphold dignity, and to strengthen the care for the most vulnerable, and to achieve, in the end, universal coverage of WASH in healthcare facilities. Gathering here in Rome under the patronage of the Vatican reflects the unique role of faith-based organizations in global health and the power of spiritual leadership to inspire action in WASH in healthcare facilities. I'd like to just discuss, if someone can put up the slide of our objectives for the day. Thank you very much. We're working towards some key objectives today. The first is that we aim to secure commitments, both financial and programmatic, that will advance WASH in faith-based healthcare institutions. So much has been done already, and we will hear about that in these 2 days. And we are focused now very much on securing that momentum and keeping it moving forward. Second, we will report on progress, share key learnings, and reflect on the future direction of the Vatican WASH in Healthcare Facilities Initiative. And in doing so, we'll also shine a light on the indispensable role of Catholic sisters in providing that care. Thirdly, we will recognize the progress and the long-term engagement of the very diverse group of faith-based actors, many of whom are gathered here, on the issue of WASH in healthcare facilities. Fourth, we want to accelerate new faith-based initiatives focused on WASH in healthcare facilities, while also highlighting the very important contributions and partnerships with secular organizations. Again, some represented here in the room. And finally, we aim to move from a individual, sometimes siloed approach to remedying WASH in healthcare facilities to a global movement. We have a sense, looking at our cumulative and our collective action here, that we're approaching a movement. And so our hope here is that we will begin to think of ourselves as a movement with a plan for forward momentum. So working together to strengthen partnerships, broaden participation, and ensure continued collective leadership for the future. While we've made meaningful progress, we also do recognize that significant challenges remain. And today and tomorrow are an opportunity to engage honestly with both the progress and the challenges. And just a very quick summary, you're all so expert on this area that it doesn't need to be belabored. But a quick summary on where we are. Access to water, sanitation and hygiene is fundamental to safe and effective healthcare, we all know. And yet, still, 1 in 3 people around the world still receive care in facilities without clean water, adequate sanitation, or basic hand washing. 1 in 3. These gaps don't just undermine care. They impact infection prevention, maternal and child health, and our ability to respond to pandemics. Faith-based organizations are central to this picture. In many low-income countries, they provide between 20 and 40% of health services, often reaching the most vulnerable communities. The Catholic Church alone is the largest unified provider of essential healthcare globally. Since 2019, or even maybe 2018, the Dicastery for Promoting Integral Human Development has helped to catalyze action to improve WASH in Catholic-run facilities, with a growing momentum across faith networks. Their initiative focused on an initial 150 healthcare facilities, all of which required improvements to their WASH services. To date, more than $3.6 million has been raised to support the improvement of WASH in 87 healthcare facilities across 19 countries and 44 dioceses and archdioceses. The impact is impressive and inspiring. But we can't overlook the 63 facilities in that particular cohort which still require support to improve their wash services. We will also today hear more on the Vatican's Wash in Healthcare initiative, but this example serves to underscore the work that is left to be done across faith-based healthcare systems. We've seen important progress in recent years, and over the course of the next few days, we'll celebrate these successes and draw lessons from such efforts, but we will also keep in front of mind the scale of the unmet need. So a few words about what we think as an organizing team makes this gathering so important. Everyone here in this room understands how critical it is that healthcare facilities have reliable access to water, sanitation, and hygiene. This is a solvable challenge. We know what to do. The faith-based community's role is uniquely important. Across the world, you serve the poorest and most vulnerable populations. Whether through access to clean water, essential health services, or both, you have the ability to scale. And you continue to be of service more broadly to local communities, regardless of the power shifts underway in global health and international development. Faith-based healthcare systems have extraordinary reach, and yet their contributions are too often under-recognized in global health discussions. It also means that we are truly seeking to achieve universal coverage of WASH and healthcare facilities. We have to direct attention to these faith-based networks and systems of healthcare. That's why this gathering matters. Today marks the largest convening of faith-based organizations focused on WASH and healthcare facilities. And this gathering brings together tremendous leadership in this room and an opportunity to increase our collective impact. Just a word maybe about the kinds of discussions that we might have and how we might engage. We encourage you in this room full of experts to engage openly and constructively, to listen well and to contribute actively. To think not only about what your institution can offer, but where collaboration can amplify our shared impact to achieve common goals. We hope that by the end of these 2 precious days, we will leave not only with new and strengthened relationships, but with clear, actionable commitments that move this work forward in a tangible way, where, for example, no woman gives birth to a child in a healthcare facility without clean water. We will not be following Chatham House rules in the House here. As I said earlier, the gathering is being live streamed. So it means that everything said in this room is to be attributed, quoted, spread out as far as your communications channels can take you. We hope that you will share the commitments that you make and the collective messages widely through your social media and communications. You all have folders with materials, and if I could just again point to the back of our badges here, if you follow the QR code also on the screen, you'll find all the resources from the meeting, including a list of participants and their contacts.